Hi, my name is Sasha. I'm the pediatric pulmonary nurse navigator here at the Children's Hospital and an asthma educator with the UCAN team.
And I'm Kathleen. I am the model today.
I'm here to talk to you guys about techniques, spacer or air chamber technique, and just kind of do a quick little tutorial so you kind of understand the proper way to do it. There's 3 types that we usually teach and are really important to use within the hospital when giving and administering inhalers. The first is the face mask air chamber. We use this typically with children infant up to 5 or 6 years old, or if we feel like they have some developmental delay and can't use the mouthpiece. And the chamber looks like this, maybe a little smaller for the smaller children. This is how you give an inhaler. So you want to make sure you have your inhaler. You're going to attach it to the end. You always want to give a vigorous 10 to 15 second shake before you do a puff, and with each puff. You want to make sure the mask can go over the nose and mouth and create a nice tight seal, that there's no gapping underneath where the medicine can escape. And then you're going to do a puff. One puff, we look for 7 to 10 breaths, or we keep it on their face for 30 seconds. This is important because every child's respiratory rate's a little different, and we know with 30 seconds we're covering it. You also can tell by the flap moving, and that can be your breath, how you count your breaths. You want to make sure to take it off their face, wait 30 seconds before administering the second puff, and you always want to shake it before you give the next puff. So that's the face mask air chamber. Now, the next spacer we use, this is the mouthpiece spacer or air chamber. We usually typically with 5 to 6 year old and up kids, and we have 2 techniques we use with this chamber. We have one called tidal breathing, and then we have the holding breath. So the tidal breathing is the first one we usually try with kids that we feel like are not going to really be able to hold their breath well. They haven't quite gotten there yet to be able to do that, so we do the tidal breathing. And this is what it looks like. Inhaler goes in, make sure you shake it 5-10 seconds, take off the cap. This is the mouthpiece, should go in the child's mouth. Make sure that there is no, they're not blocking it with their teeth or their tongue, like this. We're gonna do a puff, and she's gonna take a big breath in and blow it out. In and out. Should be 7 breaths per puff. In and out. I think that's 4, 5, 6, 7. And it's always important to take a break between puffs. Wait another 30 seconds before you administer the second puff. Now, the next technique is the holding breath technique, which is like the gold standard that we use. And this is definitely for older kids, and they should always be using a mouthpiece chamber unless there's some issue like a developmental delay that they cannot. So it looks like this. You're gonna put your inhaler in, you're gonna shake it up really good. You're gonna make sure it goes in the mouth. They do a puff and a nice big slow breath in. Deep breath first. Oh yes, we always want to make sure that the kiddos are doing a breath before they take their inhalers. It kind of teaches them to get their lungs ready to take the breath. So take a big breath in, blow it out, good. And then we do the puff. Puff, big breath in, and hold it for 10 seconds. I use my hands or count out loud for the child so they kind of know what's going on. Then release. And then you take a break for 30 seconds before administering the next puff. It's really important also to remember that if you're using the steroidal inhalers, and those are inhalers with like Symbicort, Dulera, Advair, Asthmanex, or Flovent, or Qvar, and make sure that the child brushes their teeth or rinses out their mouth. If you're using the face mask chamber with those, make sure they just wipe it, use a wet wipe or a washcloth, and make sure to get it off the skin because it can cause a yeasty rash. And if you have any further questions, please reach out to the UCAN team. Our number is 804-239-0341. Thanks.
Thanks.